All right, welcome back. This is Body Garage, and on this episode we are focusing on glaucoma, and taking us through it is Dr. George Ohito. Daktari, before the break we were talking about the diagnosis, some of the diagnostic tests that you take during the diagnosis. And I'm wondering now, because this is a disease that typically one would not present symptoms, so then how would you determine the severity of the condition in a patient?
Yes, as I said before, we have to measure the pressure of the eye, look at the optic nerve. But in advanced cases, it is easy to pick out the disease. In early cases, there are subtle changes that we may not pick with the human eye.
Yes.
But once we have suspicion, we have an array of tests that we can do. We can scan the optic nerve to give us first a baseline,
Yes.
where we can do subsequent tests and compare. Secondly, because this is an objective method, we can see those changes. Number two, we do also have an analysis of the visual field. As I said, in a normal eye, when you open both eyes, you're supposed to see the extremes.
Yes.
But once you start losing the vision, it may be difficult to tell subjectively. So we have a visual field analyzer that helps us to map out your visual field, and that helps us to tell whether there is glaucoma and sometimes glaucoma-like diseases, because we have some brain tumors, for example, which will present like glaucoma, and we are only able to pick them when we do this visual field analysis. We have also what we now call the optical coherence tomography, also scans the optic nerve and gives us a picture of what we are dealing with. So there is quite a number of tests that once we suspect glaucoma, we do to quantify the damage and also to plan for the treatment.
Now let's get to the treatment bit of it. What does it look like? What are the options that are available?
Glaucoma is where the normal production of the aqueous, there is not enough drainage out of the eye. So in early cases, we try to reduce the production of aqueous so that there is a balance, and that protects the eye. Sometimes we cannot reduce it enough. So we combine processes that reduce the aqueous production, but also increase the drainage. But what if the drainage channels are, blocked in such a way that there is hardly any drainage? Then we have to do surgery. And there are also a number of surgeries. We can do what we call a filtration surgery, where we open a channel for the aqueous to flow through. There are newer surgeries where we put a tube inside the eye to drain the aqueous out. And lately, we also have laser surgery that is used to improve the drainage, the filtration channels to work better. So each individual eye will be treated as an entity. The best in one eye would not be the best in another eye. So there are a combination of factors which will determine what is best for you and for a particular eye.
So if I'm getting you right, this eye might need eye drops, the other might need surgery.
Correct.
Okay. Now let's get to living with glaucoma. How do you advise patients to live with it? Because say the eye drops, you're using them every day. Some might be painful. I might be, thinking to leave it for today, do it the next day. So how do you advise the patients to live with glaucoma?
You've raised a very important question, part of treatment. That what if the drops are painful? Yes. And some are painful. People react to drops, the components of it, or the preservative in the drop. And ours is to lessen the patient's pain, not to add to the pain. So there are various classes of medicines, and we can do a combination that is not painful to you. And if all of them you react to them, surgery is still an option. So we play around with all manner of medicines until we get the right formula.
Okay, Dr. Ari, and after now this treatment, how often would you advise a patient to come in for monitoring? And during this monitoring, what are you looking at?
Okay. Once a diagnosis of glaucoma has been made, it's a lifelong commitment to treatment and follow-up. We may use one type of medicine successfully for several years, yes, and then it starts to fail as more channels get blocked. So we need to combine, give a combination, or totally change. So we cannot do this without monitoring. So initially we would like to see you, like in our case, every 3 months. And then as you gain control over the pressures, we may extend the period or reduce it if necessary. Patients do get tired of visiting the hospital. Yes. It is tedious, it is costly, because most patients don't come from within the city. So we have to take cognizance of this in our management and discuss what is possible with the clients. We would also like to reduce the cost implications on travel, and when they are traveling, they are elderly, they need somebody else to keep them company. So yeah, this is tough, but it is something that we have to commit for a lifetime. Yeah.
You're saying it is a life commitment, but then also you said that ultimately it leads to blindness. So how do you manage now the patient's expectations?
Quite a number of times we succeed keeping you sighted for your life. A few times we fail for various reasons. Either the medicines did not work, availability is a big problem in the rural area. You may tell somebody you refill your prescription, then we see you in 6 months, but then they run out of medicine and they can't get it in the village, and they can't send somebody to the city. So they keep a long time without visiting the hospital. You may give them 3-4 bottles, and some parts of the country are quite hot, and these medicines may be denatured. Yes. So you are using them faithfully, but they are not useful. So many reasons, but we can promise to treat to the best of our abilities to delay blindness for as long as possible. Yeah.
Okay. And are there any lifestyle changes that I would need to probably look into change, especially after treatment of glaucoma?
That is very important. I did forget to mention that diabetes and hypertension may also contribute to glaucoma. Okay. And even if they don't, they may worsen the situation.
You've mentioned that there's research ongoing for home test, but for a person already living with glaucoma, are there any home remedies that perhaps you would advise that they can use in managing this condition?
To the best of my knowledge, no. And sometimes people feel like because we practice modern medicine, we are averse to home remedies.
Yes.
Anything that can reduce the pressures will have to undergo a rigorous testing procedure to know the particular chemical or ingredients that actually causes reduction. And a lot of research will go into determining their safety profile, the dosage, and everything, and it becomes part of our formal treatment. Right now, I do not know of any home remedy that works. Somebody surprised me a few years ago that Bangi, cannabis sativa, is his drug of choice. I told him we need to monitor him, even if it is informally, to monitor his pressures over a long period of time. But he disappeared, so I cannot vouch for that treatment. Yeah.
Okay, we are talking about regular eye checks to manage this particular condition. What do I expect when I come in for such an eye check?
Any eye clinic in the country, unless they do not have the facilities or the infrastructure, the first thing is to test your vision and to measure your eye pressure. Once we have done that, no matter what brought you, we also look at the inside of your eye to look at the optic nerve, the state of the optic nerve. And that is the only way we can tell whether you are developing glaucoma or not. Yeah.
Okay, and how often should these eye checkups be done?
If you are normal, it's easy to remember an annual check. If you are normal, you could go to 2-3 years. But people do forget. So we try to make it simple. Have an annual eye check. Yeah.
Okay, and you've said that there's this risk of blindness. Are there some people who get to a point where they're now blind completely? And for them now, how do you advise them to now live with that, condition?
76 million of them are blind.
Courtesy of glaucoma.
Courtesy of glaucoma, worldwide. Once you're blind, it is irreversible. There is nothing you can do about it. Do you stop living because you're blind? No. There is this lady, Senator Crystal Asige.
Yes.
She's not let blindness hinder her from achieving her goals.
Yes.
So she's one of my best, I'm one of her audience. When she talks, I listen. And we really want to empathize with her condition, because had it been caught early, possibly there would have been a change. Yes. Was the treatment inadequate? We can't tell, because I've not handled her. But it happens. She's not the only one. Yeah. Okay,
Daktari. Thank you for that. We are up for a second commercial break. When we will be back, we will now see some of the tests that are conducted when you come in presenting symptoms for glaucoma. Do not go too far. Keep it TV 47.